This short presentation is going to give a very brief overview of why we need behaviour change, what it is and how we go about it. So I've split this up into short chunks to make it a little bit easier for you. So for many of you this is going to be revision, but some of you may wish to refer to some of the references and resources afterwards. Think about questions that I ask as we go along. You might want to stop the presentation and have a think. And just ask yourself the questions to try and put into context the importance of behaviour change in dietetic practice. So let's just have a little bit of a think as to why we need to change our behaviour. And you'll all be aware of all the causes of ill health through your work. And of course, we now have COVID-19 and the worrying link that that has with people with obesity and with diabetes, and those people suffering much more seriously with COVID-19. So we've got all of those common conditions, chronic diseases that we are aware of that are linked to unhealthy behaviour. And we know that many of those common problems, are routine. That's part of how people live their lives. And clearly, unhealthy diet is our main concern. But actually, as dietetic practitioners, what else is contributing to unhealthy lifestyle and to poor health? Think beyond the diet. And the things I'm wanting you to consider there are things like smoking, alcohol consumption, lack of physical activity, use of recreational drugs, but also the stresses and strains that have an impact on mental health. And we know that stress and poor mental health also contributes to these chronic diseases. So this report by Cancer Research UK and the UK Health Forum estimates that just the new obesity related conditions could indirectly lead to 2.5 billion of NHS and social care costs by 2035. So bear in mind that this was done before COVID, before we knew anything about that. It is highly likely that the impact of COVID may well be increasing part of that challenge with unhealthy behaviours, but also the stress that I've mentioned. So let's just have a look at an up-to-date view of where we're at as a nation for England, and what's going on as far as healthy or unhealthy behaviours are concerned. So these are the most up-to-date figures that you can find. So the prevalence of hypertension, high blood pressure, was 27.9% in 2019, a slight decline since 2011. So that's going in the right direction, but not very quickly. And of course, we know of the link between that and stroke and heart disease. We've got a significant number of people, 22.7% of adults with increased or high risk alcohol consumption. And again, that had gone down slightly in the last decade, and it seems that young adults are drinking less than perhaps their predecessors. But again, this is something that was impacted on COVID. Alcohol consumption, particularly at home, went up. So there's, it'll be interesting to see how the next lot of figures come through. The prevalence of obesity is 27% of adults, so that's still a high percentage of people. And of course, if that's just obesity, that's not including the overweight. Prevalence of smoking, great news on that. That's gone down significantly and has been going down for quite a long time now. So great news, that's gone down from 19.8% in 2011 to 13.9% in 2019. But there are certain pockets of the population, those from more deprived backgrounds, are much more likely to smoke, for example. If we look at recreational drug use, that varies significantly from year to year. And of course, there's different types of recreational drugs that you might be considering, but this is just kind of giving you an overall figure of nearly 10% of people aged 16 to 59 reporting any drug use in 2019. And that could just be a one-off thing at a nightclub or something, but that includes the figures for people who have an intravenous drug related habit, so heroin, crack cocaine, those kinds of things. So those are still a significant impact on health. And then we're looking at the physical activity levels. I'm surprised it's as high as 66.4%, but this is the reported figure. So this isn't measured, it's reported. And that 66% saying that they undertake at least the recommended level of 150 minutes of moderate intensity physical activity per week. So that is better than it was, but still quite a lot of room for improvement. That basically means that there's 30-odd% of people who aren't doing anywhere near enough to benefit their health. And then if we look at the 5-a-day figures, 5-a-day fruit and vegetables, you think this message has been around such a long time, but you've got 55% of people who are reporting consuming at least 5 a day in 2019-20. But that's actually not getting better. That's gone down slightly. And that's still a major issue because of all the positive impacts that having fruit and vegetables have. And of course, that's just one marker of diet. The whole markers of diet are much broader than that. So just think about those and where we're at with healthy and unhealthy behaviours in England. And then think, well, what's happened in the last 2 or 3 years? How has COVID impacted on that? How have social inequalities impacted on that? And what's going to be the impact going forward as we have, as you know, an energy crisis and a cost of living crisis going on in England? How is that going to impact on what people do, what food they buy, what physical activity they do? Where are people going to cut back? Is it going to be the gym membership? Is it going to be the fresh fruit? What's it going to do? And there's the stress. Is that going to mean that those who smoke are perhaps likely to smoke more? Or are they going to be thinking, actually, I can't afford to do this anymore? So we just need to be mindful of the different impacts on different segments of society and how that might therefore change. But if you look at this holistically, we've still got a way to go in encouraging people to follow the basic recommendations for a healthy lifestyle. If we look a little bit more at the physical activity and obesity related statistics, so the top ones of these are 2021 data, so very recent. And this is looking at the hospital admissions directly attributable to obesity, which has gone down a little. But those where obesity was a factor has gone up significantly. It was about 700,000 a year before. It's over 1 million now. And of course, this is perhaps got the start of the COVID pandemic in it. But of course, the stats that are going to come through for the following years are going to include a lot of that. So we're going to see more those figures to go up because of the factor that obesity increases the risk of COVID being a very serious illness. The 2020 data considered, depends who you look at on exactly what the stats are. You might notice that the physical activity figure I gave you on the previous slide is slightly different. This is saying 67% of adults considered active. But look at the figures for children and young people. 47% meeting the physical activity recommendations, so 53% aren't. So we've still got a lot of work to do with our young people to encourage them to become more physically active. And just therefore to think, what do we mean by health-related behaviour change? How do we define that? And you can look at it at a variety of different levels, individual, the household, community or population. And just bear in mind that some of the stats are about families, some of them are individuals, some of them are self-reported. So there's always a level of inaccuracy in that. So what we're talking about with health-related behaviour change is helping people to abandon health-compromising behaviours like smoking and poor diet, and the other things I've already mentioned. So we want to get people to abandon those behaviours, but adopt and maintain health-enhancing behaviours. And the maintain's a really important part of behaviour change. So we know, for example, that lots of people join a gym in January. Thousands of people every year join the gym in January. A very significant proportion of them never actually go. So we're looking at not just making that decision to become more physically active, but maintaining that physical activity. And of course, stress management is going to be a really difficult one as we go forward, and we're going to have to think very carefully about how we support people in that. So we're trying to get them to give up compromising behaviours, take on health-enhancing behaviours. And when we're thinking about individual level behaviour change intervention, so this comes from the NICE guidance in 2014, which was kind of looked at again in 2019, but not really significantly changed. So this remains the valid part of it, the most up-to-date, should I say. So this is what we do as dietetic practitioners. We are working to support individuals to make behaviour change. And what we mean by that is helping someone with a specific health condition, because we often are working with people who've already got some health condition, or it could be a behaviour. So we could be working in a health promotion type role or a public health type role. We're trying to get them to change something that affects their health. And it's really important that we don't just think this is obesity related, because it's so much wider than that. It could be supporting someone with celiac disease to be able to follow their gluten-free diet. It could be working with somebody who needs nutrition support to try and help them to find a way to increase their energy and protein intake. So think about it much more broadly. Don't just think obesity and related conditions. Think about it in the breadth of your dietetic practice. Now, although it's called individual level, it could be that we're doing that through a group intervention. So we could be doing some group education. So we might be doing that for people newly diagnosed with celiac disease, for example. But the whole idea is to help individuals to make change through perhaps giving them information, giving them tips, giving them practical guidance on how to avoid contamination with celiac disease, or to still be able to go and eat at a restaurant. How's the best way to do that? So we're helping people to change their behaviour in the breadth of our dietetic practice. And the other thing that's really important that we need to be mindful of is focusing on measurable change. So it's not just about changing from full fat to semi-skimmed milk. If you only drink, half a litre of milk a week, that's not going to make any difference. So it's got to be something measurable, decreasing their energy intake enough to help them to lose weight, for example. So it's not just about a tiny change, it's about change that is sufficient to benefit health. So in the next presentation, I'm going to talk a little bit more about what influences our behaviour.